What's your topic?
Today's topic is HMOs, terrorist group, bailout propaganda, and the latest news. This is Smiley Smooth, YouTube's finest. Let's first start with HMOs, Health Maintenance Organizations. These were created in the 1930s and they lasted to the 1960s and they phased them out. Now they brought them back again in the beginning of year 2000, the new millennium. These HMOs are things that were created to, I guess, cut Medicaid costs or pass the buck on to other agencies to make money. The HMOs are not good for society, actually detrimental. I'm going to give you a story, for instance. Years ago when I was living up in Upper West Side, when I first was on Health First, was the HMO plan that I was on, I had an appointment to see my primary care physician. And it was a long waiting period. I had an appointment though. In spite of the long waiting period, I thought that I shouldn't have had to wait. I complained about it. And he told me that his paying customers are the ones who are going to get seen first. Regardless if they walk in and have an appointment, they're going to get seen first. So at this point, I didn't say anything to the doctor. I wrote the Health and Hospital Corp in the main headquarters of medical management, and he was reprimanded, and I was eventually transferred off his case. But I'm saying this to bring to your attention that all across the United States, in suburban areas, the suburbs, they have great medical care, regardless if they're black communities in the suburbs, low-income communities in the suburbs. They are definitely taken care of. When I lived in the suburbs, I go to the doctor 15 minutes, 20 minutes the most, whether I went to the emergency or my medical physician. Here in these cities, the urban areas, especially low-income black, minority, Hispanic communities, the emergency rooms are full of people. They're understaffed and they're overbooked and scheduled at their clinics. I've been to several hospitals here in the New York City area, Presbyterian, Harlem, Metropolitan, in Queens, Jamaica, Mary Macklin, North General here in Harlem, Queens General in Queens. And if you go all over, I've traveled at least 40 states out of the United States from my military and my own personal life as an adult, that I noticed in the low-income and urban communities, they got the people walking around passing the buck. You pass from one triage section to the other, and I think the government and the president and a lot of the federal government and the senators and the congressmen, a lot of politicians as well as the president should just go to these cities, the large cities, poor communities, and look at the emergency rooms and the clinics and see what's really going on. The people are not being taken care of. You know, they're actually being sent here and there and sent there. It took me 2 years to see my primary practitioner or physician at this new hospital I transferred from home. I'm in Metropolitan now. It took me 2 years, and then when I finally met my primary physician, I was told that she won't be my primary physician anymore. So this is how we're being treated. And not unless you're half dead or you have a gunshot wound, or you're severely hurt in a car accident, you got long waiting periods. An emergency room is anywhere from 6 to 10 hours, minimum 6 hours. So you can plan your whole day there. I was at the hospital today, and I got there at 9. I was in St. at 2 o'clock. But since I don't have Blue Cross or Medicare, this is how we're treated. You know, a lot of you people have good jobs, you got great medical coverage because you pay into it. So count your blessings. North Korea's at it again, talking about the terrorist groups. And they're selling nuclear weapons to Iran. They demonstrated their nuclear capacity about 7 weeks ago when they shot at one of our allies on the sea over there in the Middle East. North Korea has a 4 million man foot soldier army. We're not even talking about other personnel. We're just talking about foot soldiers. And they're challenging the United States. They want us to come over there and fight with them. Okay. Obama has just made a deal with the Republicans, and in part of the deal, he's going to extend unemployment 13 months. And he's also given tax breaks to the rich and the wealthy and the middle class. This is part of his compromise to keep the economy uh, at a certain level and hopefully improve the conditions of our present day economy. Bernie Madoff's son has killed himself. You know, Bernie Madoff was the guy that stole $70 billion from a lot of people and took their life savings, 4K1 plans from a Ponzi scheme, stockbroking Ponzi scheme. If you look at everything that's going on now, the Congress, Senate, and House of Representatives there in Washington, they always beef about bailing out the American people when we need help, whether it be home loans, mortgage, uh, unemployment, credit card bills. But when it comes to the bailout, that was $800 billion they spent to bail out the banks, corporations, and car dealerships and other insurance companies like AIG. The Congress and Senate voted on that right away, but when it comes to unemployment benefits or mortgages or credit card bailouts, they don't want to do that for the American people. So watch the people that you vote for and urge them to, look out for the American people and not their special interest groups or their investments, which the American people come first. We the ones who voted for you to come in office. All right, this is a Smiley Smooth signing off. Peace.